you've got a new piece of equipment that you're using in your practice that you're seeing really good results with your patients, and it is a spine decompression table.
It's a decompression table.
I'm going to ask you to explain what that does and what it is.
Basically, I have one patient who calls it the kinder, gentler rack, but it is literally when you have any kind of disc problems. If you have, you can. There's all different kinds of names for things, but I mean, you can have it. It says people will say it's a slip disc. There's really no such thing. It doesn't actually slide out, but a herniated disc, which just means that there's a break in the edge. Prolapse means it's farther. It can be an extrusion, which is out and separate. There's all these things. Basically, the disc has been damaged in some way.
Right.
And so because of that, then the vertebrae approximate closer. So instead of having the shock absorber, that's what the disc is, and it's supposed to be this far apart, it's not as far apart. So then all the structures, the facets, which are the gears of the spine, and the opening for where the spinal nerves come out, all of that is closed and it doesn't have as much room. So this is helping open that up. And by basically kind of tractioning it apart, it brings that material back in a little bit. It gives it a break. It gives it a rest. And it does help kind of hydrate that area again. So it has a good success rate. It's not for everyone.
Right.
And it works both in the lumbar spine and the cervical spine. So you can have neck problems. Like a lot of people have disc problems in their neck.
Right.
And a lot of people have disc problems in the low back. It's not as common in the middle,
Right.
And so those are the two areas that this works on. So, chronic cervical problems, previous accidents, things like that. But definitely low back, and low back can be from so many different things. It can be from overuse. It can be from, most commonly we think of an injury, but a lot of times truck drivers will, just sit and bounce basically.
Yeah.
And so they've got all these new fangled seats and all this kind of stuff with their own shock absorbers on the seats, which are much better. But the old ones, boy, they had terrible low back problems.
I bet farmers, it was the same kind of thing.
Absolutely.
And those,
tractor seats.
Anybody in a Jeep type vehicle.
Oh, definitely.
My wife in her car, or me in the seat next to her. So.
Yes. What kind of car?
Oh, it's a Suzuki, so it's just a bouncy one. It's just a little bouncier.
Yes.
Or the shock absorbing is not as good. So, there's a story that I remember as a kid about a baseball player named Sandy Koufax that was a super incredible pitcher, and he was pitching one inning, and he came into the locker room after finishing an inning, and they took him back in the training room, and two guys grabbed him under the armpits, and some other guys grabbed him down low, and they just kind of pulled him apart because he retired because he had back problems.
Yeah. Okay.
And so it is that same idea. Is they pulled him apart so that things could so he could go back out and do what he needed to do.
Right.
That's not a recommended thing in this day and age, but back then, what did we know? So
if it worked, it worked for him.
Yeah.
It's much more isolated. You are being very specific, whereas that's it was working, but it's very general. And if you have an injury in some other part of the spine, that would make it worse. Whereas this, we can isolate the low back, we can isolate the cervical spine. So,
sure. And it's all coordinated through like computer settings and things
Absolutely.
like that. So.
And it gradually goes up.
Right.
It's not a full on, we're just going to do. No, there's a tensioning and it continues to increase.
Right.
And in fact, you can't even. It's you feel just a gentle pull, and but it's funny because then by the time you're done, the table may be this far separated,
and
then you have no idea until it lets go. Because a lot of people it doesn't feel like it's doing anything. It doesn't feel like it, and then you get all the way to the end, and it's like, well, yeah, I can feel, or it's feeling better and that kind of thing. But then when it lets go, it has stretched out quite a ways.
For sure. So what is the usual treatment? How long are you in this machine?
10 to 15
10 to 15 minutes.
Sometimes 20, but mostly 10 to 15.
And for a typical back issue, I know it's going to depend on the severity and
Always.
all that.
Everything's
case by
different.
case, case by case. But
what we like to try, at least 3 to 5 to even see if it's going to, because the first time, not everybody can tell. But if we've tried it 5 times, we expect to know whether it's going to work for you or not. And so a lot of people, it's not too long. For something much more chronic, I mean, it could be 20 times or something like that.
For sure.
Yeah.
And the idea behind this is the disc, it might be touching a nerve, compressing a nerve.
Not the disc itself usually. It's possible, but it's that the disc, the loss of disc height is then closing the structures in the back part down, so the space of where the nerve comes out, when it loses height, when because there's a top half to this hole and a bottom half to this hole, and it slides together.
Okay.
And that's where the nerve's coming out. And there's a lot of soft tissue, but the nerve is the softest thing.
Yeah.
And so it's the thing that compresses the most. And so there's that, and then there's also the facets, which there's one on top and one on the bottom, and they come together and meet in that same area.
Right.
And without that height, it comes together. And so it is relieving that pressure, and it's helping rehydrate that disc.
Right.
So it is kind of sucking it back in. Now, why it takes more than once is it's not going to just magically fix, and then you have to support the spine in that position.
Right.
And all that kind of stuff.
Yeah, you've got to strengthen other areas and get it to hold in that spot. Yeah. So that's where other chiropractic treatments and exercises and things like that fall in place.
Absolutely.
Okay.
Yeah.
So again, this is a new piece of equipment that you recently added, and